Thankfully, if you want a better contour for your nose, or you're unhappy with a bump in your bridge, there are other ways to go about it in treating it rather than a surgical procedure or going under the knife. Park Ave Derm, we can do something called a liquid nose job, where we inject hyaluronic acid filler into the nose to make your profile a little bit more even, make that bump a little bit more slight, but still keeping with your normal facial architecture. Here is a patient, Jimmy, before pictures. From the front, you can see a little bulbousness, a little fullness in the mid-bridge of his nose, which he is unhappy with. And then also his profile, where you can see there is a little bump in the bridge of his nose. He broke his nose when he was a kid, and since then he just hasn't been as confident with the shape of his nose. We injected a hyaluronic acid filler just a little bit before the bump, a little bit after the bump. You can see in his post picture, we evened it out, gave him a nice slope, not overdoing it or making it look unnatural. He looks like himself, just a little bit better of himself, a little bit more refined. His profile is just a little bit more symmetric, and he is absolutely thrilled with these results. Generally, filler in the nose lasts about 8 to 12 months. I'm oftentimes seeing patients come back annually just to touch it up. Oftentimes on the follow-up procedures, we're actually injecting less filler, so some of that filler I think does remain. And the nice thing about hyaluronic acid filler, it can be dissolved. One thing to note about filler for the nose, you must, M-U-S-T, go to a provider or doctor who has a lot of experience injecting these areas, because there are blood vessels in the nose that can lead to major consequences if not injected properly.